Wonderful.
Hello.
It's all, we are ready to proceed for the day today. It's again an indeed pleasure and honor for me to bring one more faculty from India, from the branch of complementary and alternative medicine. Uh, if I start reading his accomplishment, credentials, qualification, and education, probably an hour of airtime will go. Just to applaud his accomplishment, but not doing so, I will take you a couple of minutes, dear viewers. My name is Pranav, and I'm the host for today's proceedings. I have with me today from our virtual studio, Dr. Gaurang Joshi from Rajkot, India. He is a renowned Ayurvedic physician. He represents ideal blend of complementary medicine plus good understanding of modern medicine as well. And today, very recently, he came back from North America, Mexico, and he was in self-quarantine mode. And after a lot of persuasion and request, I could convince him to appear before the audience. So thank you, Dr. Gaurang. He is expert in Panchkarma and skincare. He has a very good reputation in Gujarat. He is loved by his patients, adorably respected all across the globe. He is a global traveler, and he runs a established Ayurvedic hospital. That is something very unique to be recognized about. Name of the hospital is Atharva Life Science Academic Research Foundation. Of course, once upon a time, I've had such kind of dreams which I could not accomplish, and today I take pride in bringing the experts from all over the world, those who accomplish my unfulfilled dream, and he is one such elite faculty. So it's an indie honor of NPF as well as the experts globally to have Dr. Gaurang Joshi, and in next 30 to 40 minutes he will educate all of us to share more views on Ayurveda, how Ayurveda as a complementary medicine can help all of us to improve the health. And after 40 to 50 minutes, we will switch over to question and answer. As you can see at below the bars here on the screen, there are people throwing their emotions, their voices, their likes. Thank you so much, dear viewers. And the floor is yours, Doctor. Thank you so much. My first question to you today is that from your perspective, Ayurveda is known to every Indian. It's a household name. But how would you term Ayurveda as a complementary medicine science? Dr. Gaurang, please.
Good morning to all my friends in North America and Latin America. Good afternoon to all my friends in Europe, and good evening to all my friends in India and Asian countries. It's really a privilege to be here on this platform. Thanks NPAF for this opportunity. And the question is my perspective on Ayurveda. I think lots of people in the West, they know little about Ayurveda, and India, everybody knows about Ayurveda. So my perspective is Ayurveda. Ayurveda is not an alternative medicine. Ayurveda is a mainstream medicine. And there are two words that combinedly meaning Ayurveda. First is Ayu. Ayu means life, and Veda means knowledge. So it's a totally knowledge of life. Ayurveda is not an ordinary science. It's a Ved. Science is general knowledge, while Veda is above than all. So Ayurveda is it's a great Ved. There are 4 Vedas in India, Samved, Yajurved, Atharvaved, and Rigved. Among them, you will find the details or description of Ayurveda in the Atharvaved. So I would like to tell you that Ayurveda is not only the medical science, but it's a complete science of life. The roots of Western medicine is also belongs to Ayurveda. So Ayurveda is so wide. So my perspective is that it's not only an alternative medicine, but it's the mainstream medicine. If you go to any Western medicine branch, you will find all the research based from Ayurveda. So Ayurveda is a mother of all science, all medicinal science, that I want to tell you. And it's really a great pleasure and great proud for me that I am the physician of Ayurveda. I'm representing Ayurveda across the globe, not only in India. I have lots of followers, friends from all over the world, and I have visited more than 14 countries for the propagation of Ayurveda. People are lovingly welcome me, and they are always eagerly want to know more and more about Ayurveda. So this is the science, and it's a Ved, I can say. And it's really a pleasure to be here to share my views on Ayurveda. So over to you, Pranav.
Thank you, Dr. Gaurang. What a nice way of putting your thoughts to the viewers. Dear viewers all across the globe, Dr. Jubin is hosting a watch party in North India. Arif Muhammad Khan is hosting a watch party at Lucknow, India. Dr. Another expert is hosting watch party at Pondicherry. Dharmesh Vachaleji in southern India. We are very thankful to each one of you for hosting the watch party and
Yes, yes,
eagerly waiting
yes.
for. Yeah.
Yes, Pranav. I also want to say thank you, Yagni Lyons from Colombia. She joined me. Dr. Suman Khanal from Nepal. Vaidya Akshay Chauhan from New Delhi. Dharmesh from you can say from Northeast India. So I'm really thankful to all my friends who are watching this live. This is really an exclusive
Wonderful.
live
This
transmission.
enthusiasm and the commitment to our shows have put us at a pedestal, and today we are known in global scientific fraternity only because of their active contributions. And whenever we had a failure because of the bandwidth issue, they never left NPF. They always expressed their solidarity. And today you can see after almost 3.5 years where NPF today. We are live in more than 22 countries and more than 4,000 viewers are watching this live all over the world, and the
Oh,
responses are pouring in at this point in time. You are live on Daily Motion, you are live on Ayush Darpan, Dr. Navin Chandra Joshi, so and so forth. If I will acknowledge each one of them little later. But coming to the next question, Dr. Gaura, how Ayurveda is helpful to the people to maintain their health, please?
yes, the main two objectives of the Ayurveda. It's a very good question you asked me, then I'm really pleased to clarify these views of Ayurveda. The first aim of the Ayurveda is swasthasya swasthya rakshanam, means those who are healthy, make them more healthy, not physically, but mentally, emotionally, spiritually, by all means. How? Is I already told. Ayurveda is a science of life. So there is lots of things has been described in Ayurveda. If particularly in the West, little this is on the mixed season, you are little bit switching over to the summer, but still there is a winter is there. So what you need to eat during the winter, what kind of clothes you need to wear in the winter, what kind of drink you need to take during this season. So it's seasonal. It's called Ritucharya. Then Daycharya. In the day life, what kind of food according to season you need to eat? What should be your lunch time? What should be your breakfast time? What should be your dinner time? And what should be your ideal time to go to sleep? Everything has been mentioned. You just need to follow it. I'm sure that those who are listening this live uh, from the west, they at least understand this thing that by just modified your diet and lifestyle you can remain healthy. There is no need to take any kind of herbs or medicine. Ayurveda is not the science of medicine, it's science of life. So just modified your day life, your night life, you need to manage your stress, and by that way you can stay definitely healthy. Just follow Ayurveda thoroughly. Second, I would like to tell you the second aim of the Ayurveda, that is aturasya vikara prashavanam cha, means those who are getting ill. Ayurveda definitely help you to get rid from all these kinds of complications. But again, I would to tell you the first aim is to prevention. Prevention is better than a cure. So Ayurveda emphasize on preventive mode. So if you follow it thoroughly, by following its diet, lifestyle, stress management, and day life, night life, seasonal life, then definitely it's going to be helpful to keep you healthy by all means, not physically, mentally, but physically, mentally, emotionally, and spiritually. So Ayurveda is a, I can say, it's a total package. You just need to follow it. You just understand it, the basic aim of the Ayurveda, and definitely it helps you to stay healthy. But switch
Wonderful.
over to.
Yes, dear audience, we are live on Twitch TV, on Periscope TV, on Daily Motion, on NPF YouTube, Ayush Darpan YouTube. Thanks, Dr. Naveen, for giving us access and terminal to your audience. We are live on a couple of timelines of Dr. Gaurang Joshi, on timeline of NPF. So thank you, Doctor. My next question to you is, I heard very highly about you for your accomplishment in skin diseases. So how do you generally treat the patients of the skin disease with the help of Ayurvedic medicine, Doctor?
Very good question, Pranav. Particularly, I'm practicing since last 25 years, so it's a rich experience. And also, I would like to tell you that I am the third generation in this noble profession, because my dada, my grandfather was also Vaidya, my father is also a doctor. Myself is also a Ayurvedic doctor, and my wife is also a Ayurvedic physician. So this is a third generation. So it's, I can say, it's in my blood. It's my genetic profession. And when I started my career, why I developed my interest in skin disease, because in the Western dermatology there is a lots of limitations, and there are lots of opportunity for the Ayurvedic physician to give better relief to the patient with Ayurveda in the skin disorders. Now, Pranav, all my viewers, I would like to tell you that when the skin disorders has been discarded by the modern Western dermatologists, and they told them it's not going to be cured, when they are coming to Ayurveda, you will surprise that they are not getting only relief, but in most of the cases they are getting complete cure or complete remission from the skin disorders. So we have developed a treatment protocol for certain skin disorders like skin psoriasis, eczema, lichen planus, vitiligo, dry skin, all this. And that the protocol that we have designed, I have given the name, that name is complete skin detoxification treatment. So in that treatment we are giving internal cleansing, we are going for external cleansing, we are going for the stress management, we are going with some herbs, we are going with to enhance the immunity is also one of the line of mode of treatment in skin disorders. And main thing is the counseling of the patient, because when the skin disorders patient, they are coming, they are very much frustrated because they are coming after the failure of Western medicine. So it's our role to spend maximum time with them. We are just provide maximum counseling to the patient. By providing counseling the patient, we are getting almost 50 to 60% of the result. And then rest of the role of the treatment protocol, that is detoxification treatment, some herbs, diet and lifestyle modification, stress management, these are the important part of our treatment. Don't forget, it's not a one-day treatment, it's a long-term treatment, right? And you need to follow the diet, lifestyle, whatever we are recommend you need to follow it thoroughly throughout the life if you want to stay healthy with skin disorders. So this is our style of working with the skin patients.
Wonderful, Doctor. I can see a lot of people following you on your social media. Would you please kindly look into who wants to ask you the questions, because I do not have access to. But
yes, one of my students from Canada, Sasha, she is also online with me. Thanks, Sasha. She is in Toronto. I would like to tell you, hi, how are you?
The shows are getting popularity because of your active involvement. Had you not been active the way you are, we would not have been in this profession for such a long time. So thank you so very much to everyone. And After it's going to, the program will last for at least 90 minutes. First 40 minutes, Dr. Gaurang will embolden the audience. Subsequently, we will take the questions from the audience. So if any of you have the question, feel free to ask you. Dr. Gaurang, he may not have all the answers off the bat, but
yes.
he will get back
I
to
would
you.
like,
Yeah?
yes. There are few friends, the Vishwa Ayurvedic Sangathan, Vikas, Dilawar Raja. There are lots of friends, Yagneri, all are joining this live. Bhavna, she's my wife, she's also joined. And lots of friends, Ajay. I'm really thank you, everybody. You are joining live with me, and it's really pleasure to be with you.
Yes, so my next question to you is something that I heard when we were doing research for the Ayurvedic institutes from Canada. I came across very interesting reference about you and your institute, that you are also trying to be helpful to the patients in a very acute or a serious medical condition such as cancer. So, what are your perspectives? Of course, cancers are not curable globally. Everybody knows that. But what is your
Yes.
approach for what's your approach to cancer? Please, would you be able to share something about that?
Definitely. Yeah, it's very nice question, Pranav. It's really the subject what we are dealing with, and you asked the question about cancer. Particularly, my wife, Dr. Bhavna, she is MG in Ayurveda oncology, and with her we are practicing this Ayurveda oncology. And oncology, cancer is not new to Ayurveda because the roots of modern oncology also belongs to Ayurveda. I would like to share one. Interesting research on this thing. Everybody knows about the Taxol, that is a chemotherapeutic agent. That's the Western oncologists are using for the chemotherapy. Now, from where it comes? It comes from the Pacific yew tree. That is belongs to a plant. So most of these Western chemotherapeutic agents, they belongs to Ayurveda. They just modified and just synthesize it and giving it as a part of the chemotherapy. Now, cancer, the word cancer is described in Ayurveda in the terminology Arbuda. Arbuda means a tumor, right? Now it's already described in Ayurvedic text. Acharya Susruta has also mentioned, Vagbhat has also mentioned about these things. And there is a treatment in Ayurveda that is called Agni Karma. So what Western doctors are doing, they are giving radiotherapy. What is radiotherapy? It's a part of Agni Karma in Ayurveda. They modified it, and now they are giving targeted radiotherapy. They are giving chemotherapy. Now, Pranav, I would like to tell you, if somebody is having a tongue cancer or throat cancer, and if they are going for the radiotherapy, though it is targeted radiotherapy, but the thing is that when they are targeting this chemotherapy beam, radiotherapy beam on the tumor site, definitely it can affect on some normal cells also, right? And the thing is that there are lots of side effects, particularly in the head and neck cancer, are coming with the radiotherapy. Like they are having a problem with the shaving, they are a problem with the swelling, shaving, and main problem is they are having a lots of types of ulcers in the mouth, productive cough. They are not able to chew or swallow all the things. So at that time, the role of Ayurveda is very important. We are managing the side effects of radiotherapy with Ayurveda herbs, and not only that, with this treatment, it can enhance the positive effects of radiotherapy. Patient can tolerate also radiotherapy very well if they are starting Ayurvedic protocol to minimize or to combat the side effect of this radiotherapy. The same thing in the chemotherapy. When they are taking the chemotherapy, lots of side effects are there, from reduction in the hemoglobin. It may increase the leukocyte count. It may decrease the immunity of the patient. So at that time also, we are combining this treatment with this modern chemotherapy. So this is the important role to combat the side effect of radiotherapy, chemotherapy, as well as after finishing all this treatment protocol, the important role, each and every cancer has tendency to relapse, right? So the prevention again come into the main lead. So with our diet and lifestyle modification plan, with our some herbal treatment plans, we can provide the better quality of life. At least first 5 years after all these protocol are very important. And our role starts from finishing all this radiotherapy, chemotherapy, surgery protocol. And our role is to prevent for the further relapse of the disease. And lots of patients across the globe, they are under our treatment for this protocol. And by the grace of Lord Dhanvantari, we are having a good success ratio. So this is our important role in the management of cancer. Switch
Wonderful.
over to you.
No, yeah, point taken, Doctor. Somehow uh, we are indoctrinated with mythology that unless and until it does not come from the West, we find it very hard to believe whether to go for the concept or not. And here I'm doubly proud what you say to further consolidate your views that in a very elite institute of United States, ginger optional is being given as an adjuvant therapy to the patients, and it's in a prescribed format being practiced in a very eminent hospital here for the patients, those who are in on a chemotherapy, whereby people at India are indeed blessed to have all this knowledge, understanding, and the applications and the experts various like Dr. Gauran, who knows where to kick in and where to step back. Here, the things are in the exploration phase, and gingival optional is an adjuvant therapy for the patients on chemo. So, point well taken, Doctor. No, it's very good. I'm
Thank you.
quite impressed, and it's definitely a very good adjuvant therapy here in the West. So, coming to the next question, Doctor, how effective is Ayurveda in the treatment of panchkarma? I do not think body is getting intoxicated or detoxification is classical word of Ayurvedic medicine, but I would put it in a different way. In a case of rehabilitating the body, how panchkarma is effective, Doctor?
Yes, first I would like to tell you Panchakarma. Meaning of Panchakarma means Pancha means five and Karma means action. Five types of treatment has been included in this Panchakarma treatment protocol. Now, viewers, I would like to tell you those who are in the Western countries in USA or in the Latin America or in the Europe, and now right now it's common in India too, that people are having four-wheelers or two-wheelers. It's very common. Now, I would like to tell you one thing, that if you are having a four-wheeler or two-wheeler with us, we are taking care of the two-wheelers or four-wheelers. Am I right or wrong? Right? We are taking care of four-wheelers. If you buy or purchase the new four-wheelers, we are having annual maintenance contract of the our car. The same thing, this body. When you born on this earth, from that, when you die, it's a vehicle. We are just driving this vehicle. Have you been taken care of your this vehicle? Have you tried to go for any annual maintenance contract of this vehicle? Simply no, because we never care about our body and mind, right? If we are taking care of our vehicle, then this is also vehicle, right? If our vehicle car, if there it's get toxins in the machines or in the engine, we are going for the 3 months maintenance contract, and we just switch over to the our car dealer, and they will detoxify, they will just maintain all these things. So same thing, we don't take care of the toxin in the body. Now I would like to tell you how the role of toxin in the body. Just giving one example, there is a word that is used in Ayurveda that is called ama. What is ama? It's a kind of toxin. Now how it affects on your body and mind. I would like to tell you that your lunch time is 12 o'clock, right? If you take the lunch at 12 o'clock and your digestive process start in your body, because it's a good peak time for your Agni digestive fire. So your digestive process has been started in the stomach or in your digestive system. Now 12:30, if some of your friends come with the sweet and they offer you, just take it this delicious, there is sweet, and you are taking this sweet, and what happened? It will slow down your digestive process. Now, I would like to tell you, in normal digestive process, after finishing of the digestion, it will divide in two parts. First part is nutritive part, and second part is your waste products, right? it's very routine process in our digestive system. Now, when you are taking this surplus food after finishing your regular lunch or dinner, it will disturb your digestive process. Now, at the end of the digestion, it will divide in three parts. First part is nutritive part, second part is your waste product, and third part, it's not a nutritive part or not a waste product, but it's a kind of toxin, and that is called ama in Ayurveda. Ama is the mama of all disorders, means it's cause for all disorders. So this ama, that is toxin, and the word used for this toxin in Western medicine science, that is called free radicals. Free radicals is the causative factor for all disorders. Now this ama, when stuck into the different system, that will produce certain types of disorder. If it's stuck in the skin, they will produce the skin disorders. If they're stuck into the joints, they will produce joint disorder. So we need to detoxify this ama or toxins from the body, and for that we are having 5 types of treatment. First is vamana, means drug induced emesis. Second is purgation, drug induced purgation. Basti chikitsa, that is 2 types, that is anuvasan basti and nirupasti. Rakta moksha, and some associate Ayurvedic procedures. They are very much popular in the West, like shirodhara, pouring on the head with the medicated oil or medicated milk or medicated water, and it's going to be a very important nasya inhalation, nasal inhalation. So these are the 5 types of treatment, and I would like to tell everybody that at least if you want to take care of your body and mind, you need to at least once in every 2 years need to go for the detoxification treatment, and this is the best way to detoxify all the toxin from your body. And not only detoxify, but after finishing of this thing, it will rejuvenate your body and mind. And then after you go for some immunomodulation, that is rasayana chikitsa, you can combat all types of infection. It will enhance your immunity, and your body and mind is ready to fight any types of infection surrounding you. So it's one of the best treatment of Ayurveda, and I'm again and again want to uh, pinpoint this treatment, that Ayurveda is this best treatment, and everybody need to take this as a part of their routine life.
Yeah, rightly
Switch over to
so.
you, Pranav.
Rightly so. When you brought the reference of Ama, if I do not chip in my dollar worth of understanding of Ayurveda, of course, I am not a practicing doctor, but I would like to at least share my perspective and my understanding on the subject of Ama, and then after we will go to the next question. But I would like to remember my days of graduation when we were taught in the first BA MS course, that's Ayurvedic degree, that Vimalendriyanam Sargamalanam Lagvam Ruchihi, that is Vagpat recited in Ashtanga. I studied way back in 1987 during my first year of BA MS graduation. And I would not like to get into more details of Sanskrit shloka, but its translation goes something like this, that skipping dinner once a week is recommended, as it helps in clarity and senses of organ and body, lightness, hunger, and it overall rejuvenates by reducing the stress and tiredness and improves overall physiology. In 2016, when I was referring in the very first Nobel Prize received by none other than Dr. Yashinari Oshume, I could not refrain myself to connect to this shloka of Ayurveda recited by Maharishi Vagpat in 6th century. In fact, it still gives a dimension and understanding to the modern days scientific visit to go for a concept that can lead to help them to the mankind in right spirit, rightly given the Nobel Prize. But I used to think about that, had this Maharishi Vagpat would have been born in a country where capitalism is the nationalism, capitalism is practiced as a religion, probably international law of justice would have been flooded with the lawsuits, so and so forth. They were born with the spirituality, with to serve the mankind, inherited such a divine science of which we are today indeed proud
Yeah,
of. And that is the
Pranav,
reason that we can
I,
offer all the remedies at
yeah,
almost a negligible cost. And that's the point to be taken, my dear friends, when you try to understand Ayurveda. That every shloka in Ayurveda has a linkage with some or other Nobel Prize. The point is, we need to explore right divinity and we need to get into the subject to reach to the mankind. Yes, Dr. Gaurang, what you
I
were telling?
yes, yes. I would like to tell you, Pranav, one thing. 2 years back, there was a Nobel Prize for the cancer. It goes to one of the scientists, I think, and the principal he has
Yeah,
he's done
that's
some
the same
research,
scientist, my dear
right?
friend, Dr.
Right?
Japanese
Yes, yes,
scientist, Dr.
yes.
Oshinori. Yeah,
Yes, and the concept, if he has a research on this thing, the concept you can see that is a Langan Chikitsa,
that's
fasting
right.
Chikitsa, fasting, right? So what it belongs to Ayurveda basically, because Ayurveda is 5,000 years old science. If you just go through the Langan Chikitsa, the
Exactly.
phagocytosis that he's mentioned in this research, that belongs
Exactly.
to Ayurveda. So we can say indirectly it goes to the Ayurveda, or it goes to the
Exactly.
Vata.
That's the point I want to make here to our august gathering, dear viewers. Had that been explored, if the right person had to be given the Nobel Prize, probably Maharishi Vak, but in the light of shloka he recited probably 1400 years ago, of course it was not articulated in a way it should have been, not explored in a scientific fashion. It should have been, but honest does not, all the responsibilities do not lie on an articulator. Sometimes his dissident, his heirs, means Ayurvedic students, graduates, and the scholars need to fill up the shops and need to run after exploring something that they rightly inherited to all of us. So, Dr. Gauran,
Yeah.
our philosophy do resonates and do match to each other. That's why we are together in the same studio. Coming to the next point, Doctor, if in a case if I need to come to you as a doctor from the West, what kind of prerequisites do I need in order to reach to you? For example, look, I'm a patient
Hmm.
uh,
Hmm.
of particular chronic disease, and if I want to uh, come to come to India for the treatment, what are the protocols? What are the prerequisites of being a
Yeah,
patient of your Atharva Ayurvedic hospital?
thanks. Very nice question, Pranav. From the very beginning, we are using the technology. We are having websites, that is atharvaayurveda.com, ayurvedindia.in. There is a form on our website, online consultation form. Now we are more advanced. Now we are providing consultations through WhatsApp, right? So we are planning the appointment of the patient through video call. For that, first they need to submit all the details of the patients, right? And the name, age, sex, what are the problem they are having, what is their diet, lifestyle, where they are living, what they are doing, because everything matters. And if they went through any treatment, they need to mention all these things to us. And if they went through any investigation, they need to send us all the reports also, right? Then we will plan an appointment. Exact that time we are online on the video call. We are providing them proper line of diet, lifestyle management on the call. And if they want to come, if requires, if they want to come to the for the treatment at our center, we just plan according to our availability. We are having a very good accommodation facility here, studios and apartments and everything. Our mode of treatment is very strict. When they are coming to our center, we will plan not only the treatment, but we are planning the diet and everything. They need to follow whatever the diet what we recommend them. The food is also providing them by us. That is very important.
Oh,
And there are treatment protocols of 15 days, 21 days. Lots of European people, lots of the Americans or Colombians or all the part of the world, they are coming for the rejuvenation treatment. They are coming for the skin detoxification treatment. They are coming for the side effect management of cancer treatments. So this is the very simple protocol. we are just available on one click now on your cell phone. You just need to note down our WhatsApp number, that is +919825163953. We are available all the time to provide you consultation. But let me tell you that first you need to drop a message to us, and then we'll give you appointment time, because we need to adjust our time, because we are having our OPDs at my center, and we are providing online consultations to various parts of the world. So we need to set a time according to our availability, and then we can have a video call. Before that, you need to submit all the details of your past, present illness, and past treatment and present treatment. Then we can counsel you, we can provide you diet and lifestyle medicine. Then if requires, we can send you the herbs from our center to you. And if you require to come for the treatment, then we'll give you the time, we'll give you all these things and all this information, and then you can come to our center for the treatment. So it's a very easy thing. We are available online all the time.
Yeah.
Even if I'm traveling to USA or Canada or Latin America, then also we are providing this consultation through online.
Wonderful.
So
Point taken. What I liked about you the most is you said in our very first meeting that you do not endorse the use of digital technology as a diagnostic tool. You always emphasize people to come to you for a personal meeting in order to have, you said something, darshanas persona. What was about that? How the
yeah.
diagnosis of Ayurvedic medicine is done? Can you please tell me about that?
Yes. Darshanam sparsanam prasne parikshyata roginam.
That's
Means
what I wanted to hear. That's what I
yes,
wanted.
any Vaidya or any doctor or any physician of Ayurveda, at least this is the three very easy tools to diagnose. Darshanam means by observing the patient. If somebody is coming to my OPD and just he is sitting in front of me, when he entered to my consulting room, I just observing how he's moving, how he's standing. When he's sitting in front of me, I just observe his skin, tongue, and everything, right? So that is observation. If he is suffering from skin disorder, it's visible, right? Then sparsanam, we take nadi, that is called pulse diagnosis. It's very popular way to diagnose all your ailments of your body. And prashna means asking question, taking proper history of the patient. That's why I told you that when we are providing online consultations, we always ask the patient to provide us all the information of past illness, present illness, past treatment history, current treatment history. So we are asking lots of questions for, and we are making a list of all these questions. By taking pulse diagnosis, by observing you, we are very near to the diagnosis, that is nidan in Ayurveda. So
One
this is very
second.
easy way,
Yeah.
right?
1 second.
So,
Okay.
yes.
Yeah. So that's point taken, doctor. Point taken.
Yes.
So people are eagerly watching us, and
Yes,
they are.
Mr.
Uh,
Vikas Patil and Anupam Chitte, Dr. Mohammad Ali Pathan.
wonderful.
I'm really thankful everybody. Lots of people are live with us. They are watching this live, and I'm really pleased that I am with very global audience. That's a very good thing. And this is a live transmission with a special technology by NPAF. It's really a marvelous platform. Switch over
Wonderful.
to you, Pranav.
Yeah. Yeah. Only 1 second. There will be a bit of a. Uh, yeah. Yeah. Yes, it's going live all over the world, and it's really progressing well. I need to look after the customer feedback as well, and a lot of family members are throwing their emotions. But as soon as the program gets over, as soon as the program gets over, me and Dr. Joshi will get back to you on a personal note. Airtime is on, and we would like to move forward from here. So, what are the other disease segment, doctor, you would recommend for the Ayurvedic diseases?
There are lots of autoimmune disorders are there. There are lots of skin disorder. They are also autoimmune in nature. Uh, Same thing, rheumatoid arthritis. There are lots of types of autoimmune disorders are there, and there is always a limitations in Western medicine to treat this kind of problems. And the thing is that when patients or clients are going for the Western treatment, there are lots of immunosuppressant medicines they are giving to the treatment to the patient. They are giving a lots of steroids or antibiotics or antihistamines or anti-allergic treatments, right? And there are lots of side effects of this Western medicine. Now the role of Ayurveda starts when the patient is coming for the Ayurvedic treatment, right? The first role is to detoxification all the toxins of this Western medicine from their body, right? And Ayurveda has two line of treatment. First is Shaman Chikitsa and second is Shodhan Chikitsa. Shaman Chikitsa, it's by herbs, by diet and lifestyle modification. Second is Shodhan Chikitsa, that is purification or detoxification treatment. Now, in Ayurveda, the first line of treatment is Nidana Parivarjanam. What is Nidan? I would like to tell you that if anything happens in your body, there is something that is a causative things in your body and mind that will disturb all your body metabolism, and by disturbing this metabolism it will produce the disorders, right? So there is causative factors. That is very much sure that the causative factor is I would like to tell you about skin disorders, right? If you are eating some inappropriate food combinations, inappropriate way of your lifestyle, you are having a lots of stress, and you are having uneven lifestyle, that may produce lots of skin disorders. Now, if the patient is coming for the skin disorders or any autoimmune disorder, we just taking proper history, what the diet he or she is taking, what is the lifestyle he or she is having, how much stress he or she is having, and that are the causative factors. We need to identify the causative factor first, right? And the thing is that if you avoid these causative factors, it means you are breaking the channel. That is the main causative factor. If you avoid this causative factor, 50 or 60% of the patient, they are getting relief from all the symptoms. Now, rest of the treatment, that is the pathology has been produced in your stomach or in your body. We need to break down that pathology. That is called Samprapti Vigatan in Ayurveda. So first is avoid the causative factor. Second is Samprapti Vigatan. And for that, we are using different types of treatment protocols. First is like some Shaman Chikitsa, or by giving some herbs, diet, lifestyle modification. Second is Shodhan Chikitsa, that is called detoxification treatment in the form of Panchakarma treatment. And we are deciding all this treatment protocol as per the patient's physical and mental status and as per the requirement of the disease condition. Very important thing. Disease condition is very important. We need to identify if this patient is going to tolerate this thing or not. Accordingly, we are planning the treatment. So science, this is a very calculated science. Ayurveda is very calculated. We are not doing anything blindly. Totally calculated treatment plan is there. After detoxification treatment, there is a certain diet protocol that is called Sansardhan Karma. That is also we need to follow, because we are just changing the detoxification treatment, the metabolism, we need to re-establish that metabolism again. So once after detoxification treatment, you need to go through this Sansardhan Karma, and then you need to switch over to the normal diet. So it's really a very good combination of treatment, a total package. And not only skin disorders, but joint disorders, psychosomatic disorders, rheumatism, we are using in cancer treatment. And even if people don't have any problem, then and then also they can go for detoxification treatment, because the aim of the Ayurveda is swasthasya swasthya rakshana, means to keep them healthy, and for maintain their health. If they can go for the Ayurvedic treatment, it's one of the best thing.
One
So switch
second,
over to you,
I would
Pramod.
like to interject here. There is a feedback coming from the different medias. There is a question coming to you from Dr. Joban Randhawa from Northern India. She is asking the question to Dr. Joshi that would you please enhance your Ayurvedic aspect on pathophysiology concept of autoimmune disorder. And by the time I let you give the answer, let me read out a compliment loud and clear. Dr. Muhammad Arif Pathan, who is going to broadcast an event, and we are going to lease our infrastructure to them on 6th of July. Thank you, Arif. Stay tuned. You are wearing, we can see here. These are the live proceedings being broadcasted to more than 22 countries through 26 channels. You go to Twitch, you go to Periscope, we are live without interruption. Hit your problem of a bandwidth. 4 Facebook timelines are smoking the data today. And this is the day we planned, we dreamt of, and today I may say with absolute confidence, though the live is not broadcasting a supply chain channel, but we are not very much bothered about. We are reaching to the targeted audience through different channels, different timelines. And thank you, each one of you, very much. Dr. Joshi, would you like to answer the question of Dr. Joban Randhawa, please?
Yes, Dr. Joban, thank you for a very interesting question. Now, I would like to share an example of rheumatoid arthritis, that is an autoimmune disorder, right? Now, rheumatoid arthritis is described in Ayurvedic text is Ama Vata. Am here again a toxin. So, Vat is vitiated by the Ama. Now, here the causative factor is Ama. That is a kind of toxin. And when this Ama vitiated Vata, its accumulation in the small joints and produce the disorder that is called rheumatoid arthritis. Now, I would like to tell you that what is the causative factor is your inappropriate diet, lifestyle. They are the main causative factors, right? So we first correct the ama. Ama is means what we are doing. We just going for the ama pachan, digestion of the ama by giving them langan chikitsa, right? Langan means fasting chikitsa. So first 3 to 4 days we are giving the langan chikitsa to the patient. So it will digest this ama from the stomach, from all parts of the body. And the most important thing is that in ama vata, your digestive fire is going down. So we need to aggravate, or we need to correct the digestive fire, right? Once we need to correct the digestive fire, it will digest all the ama. Then we can go for the detoxification treatment. Here we can go for virachan treatment, or we can go for this rakta mokshan, that is bloodletting treatment. So now what, first we need to digest the ama, then we need to remove the ama, because it's a pathophysiology. Ama is vitiated with vata is vitiated with the ama. So here ama vata means they are the 2 pathological factors. We need to break them, right? So what some types of herbs, by detoxification virachan treatment, or by giving them rakta mokshan treatment, we are just breaking the pathophysiology, and we just try to eradicate arm from the body. And once the arm getting out from the body, patient definitely get relief from all the symptoms. We have lots of patients of rheumatoid arthritis. They are living quite comfortably, but the only terms and condition that whatever the diet lifestyle recommendation we are giving to them, they need to follow it thoroughly. And otherwise, all these autoimmune disorder, they are having a tendency to recurrence. So we are explaining them all these pros and cons of recurrence of all the disorders. The thing is that once they are coming to our for our treatment, we will explain everything. Yes, this is not a short-term treatment. You need to plan for long-term. After continuation of the treatment, you need to follow the diet, lifestyle, stress management throughout the life. That is the important terms and condition. We don't want to waste our time, and we don't want to earn that kind of money by giving them short-term relief, right? So that is our aim, providing them long-term relief from all the disorders. That is the aim of Ayurveda, and we are very much strict to our principle. We are never compromising with our principle, right? And that is the key of our success in the field of Ayurveda.
Absolutely. When Dr. Oshanori was awarded the Nobel Prize, I was reviewing the article. He started his work in 80s and was rewarded his upwards in 2016. So when you are in a process of changing pathophysiology of a very mechanism of the entire body, it takes its own time. Quick relapse,
Yes, I
definitely.
just a minute.
Yeah.
I would like to say thank you, Bhupesh Patki from North Carolina. He is watching this live. Doctor, just a minute. Dr. Muhammad Arif Khan, Dilawar Vikas Patil. Lots of people are watching. My student from Toronto, Sasas, is watching all this thing. I'm really thankful to all my followers and friends and students and patients for watching this live.
Yes, and my great fan, Dr. Navin Chandra Joshi, is applauding. Thank you, Dr. Navin, and thank you for allowing us to broadcast on your YouTube. It's going live on your YouTube. A lot of people are watching you and us as well over your
Thank you, Dr.
YouTube.
Navin ji.
You may say hello
to.
Yeah.
Hello, Dr. Navin ji. Thank you. Thank you very much for joining us.
Thanks. And dear friends, when it takes a while, every quick all in present time are in search of quick remedies, including myself. I'm not exclusion in that particular criteria, but every remedy comes with a cost. Ayurvedic medicines are slow remission inducing agents, but it autophagy Nobel Prize, and it proves that it helps right from the root causes. And we need to come out of the mythology that unless and until it is not counter-validated, I would use the word counter-validated by the Western Institute, we should not believe in certain, because I was referring the website of American Ophthalmic Society. I never found it in India, but when they run into the crisis for looking for the technical and scientific solution, for which I'm not qualified, but it is stated on the website of the American Ophthalmic Society. So people, those who are not comfortable with, can counter-argue to them, and they go for searching their solutions in Shushruta Samhita. There is a doctor, I forgot his name, who found out all the solutions of the cosmetic surgery of nose by following Shushruta Samhita and the kind of Sanskrit articulation he brings to the table. I was not only baffled, but I was flabbergasted, I was astonished, I was surprised, pleasantly surprised, and extremely happy on that at that very moment when I saw this doctors articulating Ayurvedic medicine following Shushruta Samhita with such a great respect and belief. We need to believe in our Asian partners, but at the same time, I would like to take a couple of more minutes here. Dr. Joshi, like you, flew a lot of countries, and I had a privilege to start my travel way back in 2001, first time to Hohenheim University in Germany. I visited a lot of institutes of that practice that those are involved in further research of Ayurvedic medicines, but regrettably, I did not come across single BAMS doctor performing any kind of research work in any of the institutes. So there are some kind of barriers that needs to be explored by the academicians residing at India. Who knows, scholars like you may bring some solution to that. But switching to the next question, Dr. Joshi, what are your general advices to the people suffering from hypertension?
Oh, hypertension is very common problem around the world, not in India. And the main thing is that your lifestyle is responsible for this hypertension. Again, I'm here again, the role of Ayurveda is to balance your diet and lifestyle is very important. Hypertension is a psychosomatic disorder, but first, once it started, and then it's difficult if you started some medicine to control this hypertension, that is antihypertensive, and it's difficult. But I would like to share one thing with you. 2 months back, I have a very reputed person from the society. and he is having the very good I can say in a very good organization. He was just like a president, and he came to me with the hypertension. He was diagnosed very recently with the hypertension, and then he came to me and he asked me, he's a very good follower of Ayurveda, he loves Ayurveda, so all the time he's having any problem, he first come to me for the Ayurvedic solution. And he was diagnosed with hypertension, and the cardiologist has advised him to start antihypertensive. Then he came to me, doctor, I don't want to start any allopathy medicine for this hypertension, and if you can provide me any Ayurvedic solution for this thing. And then I advised him, because I knew his diet, lifestyle. He was a very busy person, moving around in India, taking meetings with all this his organizational persons. So first I advised him to at least minimize his travel, get settled with normal diet, lifestyle, proper sleep. Then I advise him to go for meditation and pranayam. Then I would like to say thank you to Dr. Naveen, because he was with me in December at Rajkot to teach us this Marma Chikitsa, right? So I just learned that Marma Chikitsa from Dr. Naveen Joshi, and he on the second day of our this workshop, he taught us this self Marma Chikitsa, and it was very important if one can do it at their home during that day or night time. And I taught him this self Marma Chikitsa, and I advise him to do it every time in the morning, every morning and every night before go to bed. And when he came to me first time with this, I just checked his blood pressure. It was 170 100, right? And I asked him to start all this diet lifestyle modification with self Marma Chikitsa. He came to me after 15 days, right? And I just checked his blood pressure again, and you will be surprised, Pranav, that it was 140/80. See, the miracle of Ayurveda without medicine. Now he's following all this self Marma examination, following these things very regularly, and he's following diet, lifestyle according to Ayurveda. So he never required allopathy medicine as well as any Ayurvedic herbs also. So my point is that by just correcting your diet, lifestyle, stress management, you can combat hypertension in very early stage. But once it becomes chronic, and if you are on certain antihypertensive, definitely, if by following Ayurvedic diet, lifestyle, some chikitsa, you can reduce the dose of the antihypertensive. But I would not like to advise you to switch over totally to Ayurveda once it becomes chronic. So in early
Exactly.
stage of the
Very rational and very scientific. Very scientific. That's what I would like to hear from. Over-articulation and over-pitching the content has done more harm to Ayurveda than accepting it with absolute conviction and in a scientific manner that has been rightly elicited by Ayurveda. I have a question coming from Dr. Naveen, and he is asking that how to join NPF. That is a simple procedure, doctor. As we discussed in our in our last presentation, anyone can go to the website, enroll for the program, signing the agreement, and subject to the availability of slots, sponsorship, and financial resources. Because we need to book the spectrum, money plays a vital role. We will engage with the speaker, rightly so. Dr. Gaurang emerged as a very good faculty who understood the protocol. I had a very smooth ride. I had no hesitation to recommend him as a faculty. And NPF does not recommend, endorse, or what you say, modern days PR for any clinician, any doctor across the globe. This is just a platform where everybody comes, pitch the content, they put forward the views, and it's up to the viewers to decide what is best, what is to accept, what is not to accept. But thank you so much. What you were telling me, Gaurang?
Just a minute. Dr. Bhairav Kulkarni from Aurangabad is my friend. he also joined this live. So thank you, Dr. Bhairav. And thank you all the friends who are watching this live. And if you have any question, you can come with your question.
Yeah, wonderful. Thank you, Dr. Navin. And we look forward to do a lot of programs in the year of 2021. We are going to lease our facility to this Dr. Arif Muhammad Khan, I stated before, on 6th of July, but it will not be in the name of NPF. I wish at least bi-monthly or 3 or 4 times in a year, we all should gather under a common digital umbrella in order to explore the healthcare aspects that can help to serve the mankind in a sensible manner. That's the only motive NPAF nourishes. NPAF main job is to help pharmaceuticals and cosmetic companies to address their regulatory requirements, to put them in good compliance, so and so forth. But this live broadcasting has emerged as a byproduct. So we are actually, this program was designed for consolidating pharma supply chain, but more and more doctors are coming forward. They are expressing their desire. So to bring up more popularity, we started to bring in more doctors into, and now this program is more or less monopolized by the doctors, and for which we don't have any complaint. But what I want is come prepared. The way Dr. Gaurang helped me out, I have at least communication, the way Naveen Bhai helped me out from Uttarakhand. Come prepared. We don't have time, resources to educate you how to participate in a talk show, what should be the preparations, so on and so forth. If you do not have the lift, let us not waste our time. But once you come in, come prepared, because airtime is very expensive. It is not easy to get access to the airtime globally. We need to do a lot of homework before arranging the stage. So, Dr. Gaurang, would you like to say something?
Just a minute. There is one of my friends from Mexico, Diego Tomatis. He is watching this live. Thank you, Diego, for this enjoying this live. Dr. Nirupa Vadia, she's from Jamnagar. She's watching. Dr. Vikram Shah is also renowned Ayurvedic physician in Ahmedabad. He's watching this live. So I'm really pleased that all these personalities from across the globe, they are joining. Dr. Pratima Dhakal from Nepal, she is joining. Dr. Devang Karla, Dr. Nem Chandra Vishwakarma, and Dominic from the Europe is also joining us. So lots of people from across the globe, they are joining and watching this live. Really amazing. It's all credit goes to Ayurveda.
If you find any difficulty, if you want to view us live on Twitch TV, you can switch over to Twitch TV. Mixture is broadcasting us live. Daily Motion is broadcasting 4 timelines, so there should not be any problem of dropping off the bandwidth. Real figures will emerge after 48 hours. So, Doctor, would you like to share something more on a subject of diabetes, as India is emerging as the biggest capital of diabetes in present scenario. So what are your views on diabetes?
Definitely. Again, I would like to tell you the same concept what I told you in the hypertension management. There are lots of Ayurvedic doctors, they are claiming to cure diabetes, but it is not so. If you are coming in a very early stage of diabetes, right, and if you are willing to do the modification in diet and lifestyle, then Ayurveda definitely can helpful to you. But being an Ayurvedic physician, we all are having limitations. We need to accept this fact. If you want to promote Ayurveda globally, then we need to have integration with the modern science also, right? Because all the science, either it is Ayurveda, either it is homeopathy, or either it is allopathy. Every science has this limitation. But if we integrate the best of all the science, then we would have a very good results, because we are working for the well-being of the human on this earth. So again, in the diabetes, lots of Ayurvedic physicians, they are claiming that we will cure this diabetes by Ayurvedic medicine. Even we are getting some advertisement in the newspaper that we will cure 100% of your diabetes. So it is not so. First, I would like to tell you that if the patient is coming in the early stage of the diabetes and he is ready to moderate or to modify the diet and lifestyle and stress management, because because there are type 1 and type 2, right? If once it's switch over to the insulin dependent diabetes, and then it's very difficult to cure, right? You need to continue with the allopathy medicine. Ayurveda can work as a supportive treatment in chronic condition of diabetes. Otherwise, you need to switch over, you need to continue the allopathy medicine. Yes, definitely. If you follow the diet, lifestyle, and some Ayurvedic herbs, they are very good anti-diabetic properties in the herbs. Use it as a supportive medicine that may help you to reduce the doses of the Western medicine. But again, I'm really bluntly saying that we are also having the limitations to cure. There are certain conditions, certain chronic conditions where we need to integrate with modern science. So my friends, I am again tell you, in diabetes, hypertension, we can integrate with the modern science. We can reduce the dose of modern medicine, and further we can modify in diet and lifestyle. We can reduce the side effects of modern medicine. So that is our role, Pranav.
Wonderful point taken, and rightly so. See, I hate to repeat the subjective views. I wish people to follow. There is nothing like modern or Ayurveda. It's an integrated approach, as rightly Gujarati writer years ago, probably before 1992, he wrote an article, Mr. Goodwin Shah, and he wrote that allopathic gives statistical analysis and Ayurvedic medicine science gives articulation. What we need to find is a level playing field to help the patient out, to offer the right remedy with a patient pathy and any kind of integrative. And we did not coin the term, this intellectual term of integrative medicine is coined by the Westerners. They do not feel themselves belittled in accepting very fact that they look for the answers from Shushu Trainta for seeking expertise for the ophthalmic surgery or for the cosmetic surgery of the nose. They have had to go to Shushu Trainta. Had that been, I was thinking at that point in time that had that been an Indian Ophthalmic Association, they would never have remembered Shushu Trainta. So the very point is we started going off the route, away from the route, and that has posed a lot of challenges to the mankind. Autophagy was scientifically elucidated by Maharishi Vagabhat, and it was scientifically explored by the Japanese scientists. So science recognizes no boundaries, and neither should we, as a scientific as a scientific experts, those who have little understanding of the science. We should come out of the barriers, bureaucratic, regulatory, so and so forth, in order to help the mankind. And as stated in the disclaimer of the show, that we do not try to promote patient and the doctor's relationship by floating this concept, but social media are flooded with the information in which what to believe, what not to believe, who is right, who is wrong, is very difficult to adjudicate.
Pranav,
Yeah.
I would like to draw your attention on the social media or Dr. Google.
Yeah.
People are having that in the mind there is no side effects of Ayurvedic medicine. But I am again want to clarify that when there is action, there is reaction. By just reading blogs or by reading on the Google and by reading on the newspaper or social media, that is WhatsApp University, and people are doing self-medication. Ayurveda always emphasize on personal medicine, personalized medicine. There is a constitution. You are having your own personal constitution. You are having a vikruti. We also need to identify the vikruti, that is a pathology in your body.
What you are saying
Right?
is exactly what Human Genome Project is referring. Nutri-genome, human genome, all requirements are tailor-made in which to say so, yeah?
Yes, so you need to focus before starting any self-medication, either it is Ayurvedic or homeopathic or whatever things. You need to consult a qualified Ayurvedic physician first.
Exactly.
That's what I would like to do, because self-medication is always dangerous.
Exactly.
Though people are believing that Ayurveda has no side effects, I can tell you there are lots of side effects if you use it unauthentically, because you don't know what is the problem. You are just reading on the social medias, on the WhatsApp or on the Google or on the Facebook. Lots of people are sharing all their views on the certain types of treatment. They are writing the names of the herbs. They just consume this thing, and if you don't know which is best for you and you are consuming it, then definitely it's going to be harmful to you. So I want to draw attention of all my viewers, all my followers, that just keep in the mind that when there is action, there is reaction. If you use it without consulting Ayurvedic physician, there may be side effects. Keep this thing in your mind, right?
Exactly, under the
Because
right
I'm
supervision.
right, because I'm always rational in my approach. I never mind if somebody criticizes me that you are telling right, because it's my duty to tell you right thing about Ayurveda.
Oh, with the explosion and emergence of this new social media, everybody has each and everyone has their own individual right and prerogative to opine for any individual, and it will take a while for the viewers to understand and to adjudicate, to conceive and to accept what is right for them and what is not right for them. But to
Exactly.
segregate, to differentiate between what is right and wrong, we floated a series of such talk shows on a different channel. We started our talk show way back in 2016 with the 9 viewers, and today I'm proud to say so that NPF, as stated in Hotel Marriott in 2014, has become a digital umbrella that is followed by more than 20,000 viewers globally.
That's great.
Yeah.
That's great. Congratulations, NPF, for this big viewership and big subscriber of your channel. It's really a great achievement because you are staying in Canada, you all the way from India, and you have started these things. And being an Ayurvedic doctor, you are doing this live transmission. You are using this technology. I'm really appreciate Pranav, your efforts and your dedication, and you still not forget your roots. That it's really touching my heart that you belongs to Ayurveda fraternity and that you never forget, and that's I'm really salute to your dedication towards Ayurveda.
Thank you. I take your kind words with absolute humbleness. I'm truly honored. In fact, I've had a lot of failures. Failure is a synonym of Pranav in transmission as well, but very enthusiasm and the support of the people to come up again in life has always kept me going. And today's show is going to emerge as a pride show, as a new beginning in the segment of healthcare sector. I thank you again, dear viewers. You are continuously following, sharing your views and emotions. Do you have any particular question when we are in last 10 or 15 minutes of our today's proceedings? Dr. Joban, thank you so much for hosting a watch party. Every contribution you bring to the table is rightly acknowledged and taken up in the right spirit. So anybody is trying to approach you, doctor?
Yeah, just people are watching from is Romira from Spain. Then I can say one of my friends from Europe. They are joining us. So I would like to ask everybody, if you are having any question, feel free to continue your question. It will be a pleasure for me to solve all your query regarding Ayurveda. And again, I would like to tell you, I just emphasize on this particularly self-medication, because lots of patients are coming to us by using these herbs through self-medication, and at that time it's very difficult for us to find out proper solution. So again, I would like to clarify all the people who are watching or who are following Ayurveda is not that much cheap science that by reading on Google or by reading on WhatsApp you just implement on yourself. So before implementing any treatment protocol of Ayurveda, any single herbs, kindly contact a qualified physician nearby you. If not possible, then you can contact us directly through WhatsApp or through Facebook. It will be pleasure for us to guide you properly, because I would like to draw attention, because right now lots of people are doing uh, this practice through Facebook or through WhatsApp without knowing the basic fundamentals of Ayurveda. Ayurveda is the science, it's a Ved, it's a knowledge, it's I can say, and it's not easy to deal, right? So because I'm practicing since last 25 years, even Dr. Naveen ji is practicing since last more than 15 years. So we are having lots of experience, and then we are able to be on this platform. So keep this thing in your mind. When there is action, there is reaction. Not a single herb is free from reaction. So when you are consuming any herb, first consult nearby Ayurvedic physician, check your body constitution, check your vikruti pathology in your body, then correct your diet and lifestyle, then go for saman chikisa, or then go for any panchakarma or shodhan chikisa or detoxification or purification treatment. So my emphasis is, before starting any Ayurvedic medicine as a self-care or self-medication, be cautious. Be cautious, my friends. It's not easy. Because
Exactly,
Ayurveda
it
is,
does more harm
yes,
than benefiting you. Doctor, to add up what you say right now, and that really takes me back to my days in Ayurveda, and yeah, I just now received an article on Ayurvedic different. Charak and Shushruth were probably, they recited that this poetic prophecy, I would put it in this way, poetic prophecy. And look, I'm not speaking anything from a really, neither right from the beginning of my childhood, I've had to write and speak. They
everything,
recited
everything,
yeah.
everything is documented in
Yeah,
Charak Samhita or Susru Samhita. Lots of Ayurvedic texts are there, and they are the reference for the treatment.
yeah,
And I would like to tell you one more thing, Pranav, that the criteria of modern medicine has always been changed. But if you see, if you notice, there are not a single criteria of Ayurveda has been changed since last 5,000 years,
exactly.
right? So it's a
I'm coming
Shastra
to that
style.
point. I showed this papers to you because I'm not speaking from the pre-written script. Every word that comes within the heart, and right from the beginning of my childhood, because of the divine blessings of my late revered father, who wanted me to be a prolific Ayurvedic physician like you and Dr. Joshi, which I could not be. But if I do not remember my great father, without him, no conversation ever completes in the segment of Ayurvedic medicine. Every time, but he was a very good scholar of Ayurvedic medicine, used to make medicine by himself. That prompted me and inspired me to go for. But very vital aspect, beside to getting these degrees and making statement on the media, is of the divinity. All the Ayurvedic diagnoses are based on divinity and super intellectual understanding of the subject. When Charak
Right,
and
right.
Shushruth described 7 layers of the skin, sometimes
Yes.
1600 years ago, they did not have access to the electron microscope. Today, American Chemical Society acknowledged that what kind of divinity they have had that they described. Why they did not say 7 to 8 or 9 or 10 layers of skin? When they
Yes.
when they elucidated that in Madhumeha, yoga of royal jelly can be given, though it is sweeter in taste. American Chemical Society, under the leadership of Richard P. Steiner, Nobel laureate, proved that royal jelly quickly lowers blood sugar, though it is sweeter in nature.
I would like to tell you, Pranav, one more thing. The beauty of Ayurveda, pulse diagnosis, Nadi Pariksha.
Oh, wonderful!
Now, yes, the people are going for the investigation like blood pressure or electrocardiogram, ECG, all the things. But if a Vaidya he's in expert Nadi Vaidya, then by just observing the Nadi or by observing the pulse, he can diagnose everything. Even
Exactly. That
just
divinity
yes,
part is
yes,
missing. That divinity part is
yes,
missing. And last time
yes,
also I stated very categorically that Charak and Shushru did not go to particular, I don't want to bring down the glory of the university that gave me my first degree, but the very point is they were not MDs and PhDs or super PhDs or triplet PhDs of any particular institute, either from the West or East. They were the
right.
devotees. And the factor of devotion is indeed missing from this divine branch of Ayurvedic medicine, and that has curtailed the wings of prospering of the Ayurvedic medicine, dear friends. If anywhere the problem lies in enriching the science, in expanding the horizon of the science, in curtailing the wings of the science, lies and honest lies with the promoters and propagators of Ayurvedic medicines, not with the Charaki Chushruta.
Pranav, I would like to share a few of my experience on the skin disorders.
Yeah.
Right? I have lots of patients from around the world. Right? I would like to share two stories with you. I have one Britisher from London. He was having psoriasis more than 18 years. Right? So he just went through my website and he contacted me. He emailed me and he sent me this all the details that I'm suffering from 18 years. And doctor, I tried everything except Ayurveda, right? And I never get a single relief in my symptoms, and I'm so tired. I'm having all the time negative thoughts that I need to commit suicide. Then I immediately replied him that if you want to experience Ayurveda treatment, then come for the purification treatment to my center. Again, he wrote me that I just came to know that Ayurveda is unpleasant treatment, right? Then I wrote him this: you need to experience it by yourself, and then you can decide why either it is pleasant or unpleasant. Then immediately within 2 days, he came to my center. Now, Pranav, that thing is that we started the Panchakarma treatment to him, and on the 10th day of the treatment, all the skin became normal. It was a miracle, right? On the very 15th day of the treatment, where it was the last day, he became quite normal. Skin became all the came back to normalcy, and then he went back, and he just following all the diet, lifestyle. Still, he's continued some hops with me, and I met him twice in London when I was there in 2017 also. The same story with one of my patients, one of my friend in Spain, Madrid, Antonio. He was with me. It came for 4 times to my center. Psoriasis, for the psoriasis, it's very complicated skin disorder. He also having the same story with 15 years of psoriasis, and he tried everything. He was also tired, and I explained him all the things what I explained to my British patient, and he came for the detoxification treatment 4 times to my center, and since last 4 years he is living quite comfortably, asymptomatically. I was there in the October to Madrid, and you wondered that being an Ayurvedic physician, I'm also proud that he waited for me on the Madrid airport for 2 hours, and he was so pleased. I spent few days with him, with his family, and still he's been in touch with me even in this right now this global pandemic crisis. He is in touch with me. I'm advising him to follow Ayurvedic lifestyle, diet as a precautionary measures, and he's and his family following all these things. And right now Madrid is the hotspot of this global pandemic. In this crisis, by following Ayurveda, he and his family are right now very healthy in this
Oh,
crisis
wonderful.
too.
Thank you,
Right?
Doctor. Sorry, now we are running out of the time. We have last 5 minutes. We also take the feedback of Mr. Shir Sagar Rajendra to make the pronounces clearly. We take your feedback. We will try to rectify. Thank you so much for your time and joining us today, Mr. Rajendra. And yeah, so what was the second? And continuously, I'm getting very positive feedback from Jovan Randhawa, an Ayurvedic physician. She is telling that it's very mandatory for an Ayurvedic physician to work for himself. Yeah, and she also emphasized on the divinity. Thank you, Jovan. So what you wanted to say, Doctor, when we wrap up the conversation of the day today?
Dr. Siddharth Singhal is also watching this live. I'm thankful Dr. Rajendra Sagar, and I'm really thankful to all of my friends, followers across the globe for watching me, for following me continuously. And there are lots of seniors are also watching this program. And if I want to tell you, if you can advise me what the correction I need, I'm ready because I'm always a learner. I'm a learner of Ayurveda,
Exactly.
and I'm all the time learning from you all. There are lots of role models that to whom I am following because I'm not a legend. Ayurvedic physician, but at least
In the field of Ayurveda, nobody is legend because textbooks are written in Sanskrit.
Yes.
Textbooks are written in Sanskrit. And when you see this poetic prophecy being recited by Americans or German in Sanskrit, we feel baffled and ashamed of not inheriting this legacy in a way we should have been. So I do not say it. You be humble, but don't be so modest, Doctor. You have a lot of accomplishment under your belt, and we are very proud to have you here today. Today's agenda is not going to be driven by the media. It is your scientific contribution, you, Dr. Naveen Chandra Joshi, Joban, and all the experts, those who are committed to embolden the science of Ayurvedic medicine to further empower, to pass it on to the next generation. When I look at such pragmatic professionals in the field of Ayurvedic medicine, I today even feel that the medicine itself is in the safe hands. Otherwise, I had seen a lot of compromising situations before literally jumping out of the boat. It was not a smooth exit before I decided to diversify my career into a different segment, but certainly not my belief and conviction in the branch of medicine I stand for today, and I will stand till I breathe my last. Ayurveda is a medicine. It has great inheritance to the mankind. What it needs is the proper exploration. With that spirit,
yes, just a minute. Romina from Salman Classmates is watching this live. Thank you, Romina. And again, I'm just following the legacy. I'm proud to be a Vaidya of Ayurveda. I'm following the legacy of Ayurveda here. And I'm really thankful all my friends who are watching me live from across the globe. And it's all about Ayurveda. Feel free to ask me anything if you're having any queries regarding Ayurveda, regarding your health.
When we wrap up, what's your, quickly, in last 2 minutes, we don't have much of the luxury of time. What's your one website address and one email address, please?
My email address is Dr. Gaurang, GAURANG _JOSHI Joshi @yahoo.com. My website is ayurvedindia.in. ayurvedindia.in, AYURVEDINDIA.in, and atharvaayurveda.com, ATHARVAAYURVEDA.com. Again, I would like to say, Sarve Santu Niramaya, keep yourself fit, keep yourself healthy. God, Lord Dhanvantari, bless you with good physical, mental, and spiritual health. Thank you, NPAF, for this extraordinary live transmission across the globe.
Thank you, Doctor. I'm left with last 2 minutes at least to express word of thanks on behalf of NPAF. Dear viewers, after repetitive failures, it was your belief in the system, in 4K transmission facility of NPAF that has kept us going thus far. Today's transmission is going to turn around the table. We would like to bring in, as you all know, we have had Dr. B.M. Hegde, to whom I believe the ultimate wizard in the branch of medicine. I don't care what people think and opine about him. Dr. B.M. Hegde in this program, Dr. Nandita Shah, Dr. Jay Sheikh, we try to bring in more experts from healthcare sector. This year's alternative branch funding for the resources for alternative medicine is exhausted with a couple of programs simultaneously. We will announce a big program in the year of 2021, as there is great amount of interest in alternative medicine all across the globe. The best way to approach NPAF is go to the website, enroll yourself as a speaker, demonstrate your ability. Do not bother too much to the faculties and the speakers who appeared before. And we do not expect any kind of vouching or over approaching. We absolutely go based on merit. If you have quality education and credentials that can enhance the brand value of NPAF, you are in. Otherwise, please forgive us. We are going to be a mega show in healthcare sector in years to come. I thank you again so much, and thank you, Dr. Gaurang. Any last word?
Thank you. Wish you all a very happy weekend. Keep yourself healthy, enjoy, and stay healthy forever.
Thank you.
Because at Atharva Ayurveda, we believe start living healthy. So from today onwards, just start living healthy.
Yeah, very soon the channels will switch off. One by